I think it's strange for many of my patients and my colleagues to understand why a surgeon wouldn't operate. And I think it's because people think it's such a calling and that surgeons enjoy surgery such a lot and that it's part of who they are in their persona. To me, it's just a job. And whatever tool I need to use to do the best I can for my patients, I should use. And surgery has evolved over the years. You have endoscopic surgery where you use little cameras, and surgery has become minimally invasive over the years. So in a way, what I am doing is performing surgery because I'm relieving people's pain with a procedure that has temporary capacity. And that's true for surgery as well. And when you're looking at a disease where it's a progressive disease which continues on and on and on, no matter what you do, then you have to be very ethical and sit down and think and just look at the world literature and the trends and say, what is it that you're using to relieve the symptoms that the patient has? And are you using the correct tool? And if you're using a spade when you should be using a trowel or you should be using a teaspoon, then you're doing the wrong thing. And it's very clear in the world literature that surgery should be reserved for very few conditions as far as spinal pathology is concerned. So I'm actually just following the world trends and doing that in what I think the most honest way is that I can. And do I miss the surgery? Sometimes a little bit, because it is part of the skill set that I've built up. But more so, I have this responsibility to do the right thing when it comes to patients. And the focus is so strong that I don't even find I haven't found any space at all in my calendar to, for the few patients that require surgery, create space for that, because that breaks my focus. And I've got great colleagues, who I've performed surgery with all my life, who I trust, and if I do find patients that require surgery, I refer them onwards to them. And so the system is pretty perfect in that sense. And I revel in what I'm doing now, and I go to bed at night with a smile on my face. So, and that's the reason I moved.